Assalamu alaikum wa rahmatullahi wa barakatuh. Aminullah. Yeah. Don't worry. I'll use my, don't worry. Fine. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters in Islam, it's me, your Director of Programs for the 8th MFB Summer Conference, once again, Abdul Rashid Salvador. And I have with me Dr. Aminullah. Dr. Aminullah, can you please show your face?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. MashaAllah. Alhamdulillah, we are into the last day of the MFB Summer Conference, the 8th MFB Summer Conference, inshallah. In the last 2 days, we've had soul-inspiring lectures, fantastic programs for our children, for our youth, for our brothers and our sisters, and for all of us in general. Yesterday was our main lecture. Alhamdulillah, despite all the heat that we experienced with the technical, the network and all that, alhamdulillah, we were still able to have, a very inspiring lecture from our Sheikh Ahmad, the Chief Missioner of our Southern State of Nigeria, as well as Dr. Abdul Majid, who stood in for him when we have the technical hitch. We had fantastic youth programs yesterday. I was discussing with my son, asking him what were the lessons learned at the program yesterday. And it was quite interesting that he elicited lots of discussion between myself and my boy and his friend that was with us yesterday. Alhamdulillah. Our sisters also had their own programs yesterday, and I think our brothers will be looking forward to our own program later tonight. Right, Dr. Aminullah? Dr. Aminullah, are you looking forward to our program tonight?
Yes, absolutely, I am. Sorry, I have muted. I just didn't want interference with your beautiful introduction, sir. Yeah, so inshallah, yes, our program, of course, as we are all looking very much towards the lecture now, which is going to be the deadly trial. And inshallah, it promises to be a very important and important session, because there's so much knowledge for us to learn from this particular session, as we have learned from all the other sessions that my co-anchor I just mentioned to you. I'm sure that this morning we have had very, very, important session as well with the youth, which was, open to everybody to participate in. But most importantly, I want to let us know that all these lectures are available on YouTube. So in case you have missed any of it, please do not feel disappointed. You can always go to our YouTube channel, the Muslim Forum of Britain, and get a rewatch on our YouTube channel.
MashaAllah, MashaAllah. So without wasting so much of our time this morning, inshallah, we are going to kickstart today's lecture, which is the daily trials my brother just mentioned, and will be delivered by our able doctor in the house, Dr. Takib Azan. Dr. Anullah, could you please introduce our doctor to us, please?
Alhamdulillah, Alhamdulillah, we have him already with us. And I don't know where to start his introduction from, because he's also a very, very known face to me. But then I will just probably go by the script. So Dr. Takib Azan is here with us and very much around. So inshallah, we are going to be starting the lecture very soon. He finished his secondary education in Lagos, Nigeria, and he studied medicine and surgery at the University of Lagos. The first, how do they call it? The first choice and the first school and the nature's choice. The University of first choice. I'm not doing justice to that. Please pardon me, Dr. Asad. So, and he finished with a very, very good grades, mashallah. He worked at, so he's also pan-Nigerian. He worked at General Hospital Bunza in Kebbi State as casualty officer at the A&E department, and also as in Kebbi State, and also worked as casualty officer in the A&E department of Lagos University Teaching Hospital, where we trained as including myself. And he finished residency in internal medicine in the cardiology subspecialty. And of course, he has been very, very active in the part of the deen as well in Dawah. He was one time a Naib al-Amir of the Muslim Student Society of Nigeria at the area council of an area council in Lagos State, and also as a medical student. So he's at the moment working as a consultant physician and cardiologist at Oak Hospital in Ikorodu in Lagos State, Nigeria. I have the pleasure of welcoming on board today to give us a very important lecture, Dr. Takib Azan. Bismillah, doctor. Are you ready to start?
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Inshallah.
Okay, thank you very much. Alhamdulillah Rabbil Alameen. I want to thank Allah, and I also want to thank Brother Dr. Aminullah for that lovely introduction. May Allah subhanahu wa ta'ala continue to accept all our acts as an act of ibadah. I feel privileged to be invited to give this talk. It's going to be I'm going to calm down because I understand a number of our audience most of our audience are not necessarily medically related. So I'm going to share my slide shortly, so that we can all have a glimpse of what I'll be discussing. Like Dr. Aminullah rightly said, the topic is deadly trial. Okay, I need to be disabled. I want to share my screen now, but it's saying I'm disabled. Can that be addressed?
Yes, we'll address that shortly, inshallah.
Okay.
Yeah, we can see your screen now, doctor.
Okay.
You can see your screen.
All right. So the talk is going to be centered on, yeah, can you hear me? Okay, thank you very much. So the topic is essentially on the deadly trial. Like I said, my name is Dr. Hassan Olayinka Fakib, and all that has been said previously. So what are we talking about, brothers in Islam? Is it this?
Sorry, Dr. Fakib, if I may suggest
representation of what we are going to be discussing. I mean, this summarizes everything we want to.
Yeah, Dr. Fakib, if I may suggest, you can have the video off to improve the network, if that is fine.
A patient like this, but not necessarily a patient. Yeah. Can you hear me?
Yeah, maybe you can put off your video, doctor. Put off your video. Hello? So that the network can be better. Can you hear us, sir? You can put off your video so that we can hear you. Just put off the video and we can see the slides.
Okay.
Your video is still on.
Okay, no problem.
It has also taken off your slides. Have we lost doctor?
I'm afraid so.
Okay. Let's see. Please exercise patience with us, our brothers and sisters in Islam, while we try to reconnect our doctor.
Sorry for that technique. I guess I'm back.
Yes, but your video is still on. So if you want to, just because of the quality of the...
My video is still on. Okay. Okay. internet connection appears to be poor. Okay, I thought I had done that. Okay, hold on. I'm sorry. Yes. Okay, I think the host, can you hear me? The host have stopped my video. That's fine. Let me share my screen now. Is that fine?
Yes,
we can hear you.
But your audio is better now. Alhamdulillah. So
okay, can you see my screen?
brilliant.
Yes, we can see your screen, mashallah. The audio is better now. Bismillah.
All right. So I'm sorry for those stuff. So like I said, this is it. Deadly trial. So when we talk about deadly trial, what are we talking about, brothers and sisters? This is the picture that represents everything. A client come to the hospital, you see something like this. Oh, you almost always you make a diagnosis. So we are talking about what we call metabolic syndrome. Metabolic syndrome, that is the name. Now, what do we mean by metabolic syndrome? We are talking about some aggregates of metabolic abnormalities, okay, that confers increased risk of cardiovascular disease, okay, and diabetes mellitus. So it is not just a single entity, okay, it comprises of a number of disease entities. Some are metabolic, most of them are metabolic, and the ultimate thing is that if you have 1, 2, 3, 4, or all of this symptom, it tends to your cardiovascular risk is increased. So now we should know that when we say cardiovascular risk is increased, we are talking about, oh, that is potentially serious problem, because we do know that cardiovascular disease is the leading cause of death globally, across the world. Only in 2019, some 17.9 million deaths were attributed to cardiovascular disease. Here are some other synonyms. Okay, so sometimes we refer to it as syndrome X, cardiometabolic syndrome, cardiovascular dysmetabolic syndrome, insulin resistance syndrome, beer belly syndrome, and Raven syndrome. So all these are talking about the same thing, metabolic syndrome. So how do we tell if somebody has metabolic syndrome? These are the criteria, basically. I'm going to be sharing 2 criteria, but this is one of them. First of all, which is key, is what we call the abdominal obesity. So if you are able to take a measurement of your abdomen, and I'm going to tell us how to do that shortly. And in men, if it is greater than 102 centimeter, in women, if it is greater than 88 centimeter, you have satisfied one of the criteria. If you go to the hospital, we take your blood and we test what we call the triglycerides. If it is greater than 150 milligram per dl, you have satisfied another criteria. In addition, if your HDL, that is the one we call the good cholesterol. So we actually want it to be high. So if it is low or lower than 40 milligram per dl in men, or lower than 50 milligram per dl in women, you have satisfied another criteria. If your blood pressure is consistently greater than 130/85, sometimes you see 140/90, that is another criteria. And finally, if your blood sugar is greater than 110 milligram per dl, again, these are tests that we can do in the hospital or in the medical, in the laboratory. If it is greater than 110 milligram, or sometimes 100, depending on how strict you want to be, then you have satisfied that criteria. So if you have 3 out of these criteria, I've mentioned 5 as you can see, then you are on your way to developing, you have metabolic syndrome, and that is a key. I usually say that's the key to cardiovascular disease. Just like we say that the key to salat is ablution, or the key to cardiovascular disease is developing metabolic syndrome. Okay, so according to the International Diabetes Federations, I mean, their criteria is slightly different. It's even more rigid. So in men, as much as 90 centimeter is considered a risk. In women, as much as 80, okay, is considered. So as you can see, these criteria appear to be stricter according to the international IDF, because we want to pick patients with metabolic syndrome even early. Here you can see that the blood sugar is 100, that is the criteria, okay, and the waist circumference, we even want something lower. All right. I need to mention just in this third slide, sometimes if you are already on, it's the same slide basically, but if you are already on treatment for blood pressure, so you have established hypertension or diabetes, and you are currently on medications, then you have satisfied the criteria. So it doesn't matter whether you come to the clinic and your blood pressure is 110/70, provided you are on blood pressure medications, then you already satisfied the criteria. Or you're already on drugs for diabetes, even if your blood sugar is lower than what we've quoted here, then it is also a criteria. So I just need to note that. So like I said, if you have 3 out of these risk factors, then you have a metabolic syndrome. Importantly, and I need to emphasize this, abdominal obesity is arguably the most important of all these criteria, and it is the one that is highly correlated, with metabolic syndrome. In fact, it is more important than BMI. You know that BMI, we compute your weight, and your height, and we say your weight over height square. So for people who have BMI greater than, less than or equal to 25, we say that is fine. Between 25 and 29.9, we say the person is obese. Above 30, the person is mildly obese. From 35 to 39, the person is moderately obese, and anything greater than 40, the person is severely obese. So BMI is also a way in which we say people are obese. However, abdominal obesity has been found to be more important, and I'm going to share the details shortly. Also, we should know that some men develop metabolic risk factors, even when the circumference is not as much as we've quoted before. We've quoted 102, we've quoted 90, depending on the criteria we want to use. Some people even at 85 or less, okay? If the other risk factor, like I've mentioned, for example, the blood pressure is high, the blood sugar is not controlled, then they are also they are candidates for metabolic syndrome. Central obesity is a keystone in the pathogenesis. So anything you are eating or you are drinking, if your tummy is getting big, in an isolated fashion, then that is that's a risk factor. All right, so the waist circumference I'm describing, this describes how to sort of measure it, okay, so that we can be sure we are doing the correct thing. If you put your hand on your waist by the right and left, you'll be able to locate what we call the upper hip bone, okay, by the right and left. So how do you measure? You place your measuring tape around the abdomen at that point. Ensure that the tape, okay, does not compress the skin, okay, and it's parallel to the floor. Then take your measurement at the end of normal expiration. You know what I mean? Expiration, your tummy gets flat, So when you have finished breathing out, okay, you take the measurement. If it is greater than what we've quoted, then that's a potential problem. Okay, this is a slide that attempts to explain the difference between what I call the body mass index and the waist circumference. So if you look at these two, okay, sorry. Okay, if you look at the diagram, we have a man and a woman. Now, in the first two pictures, you see that both of them seems to have, very close BMI. Okay, so 29 and 28. However, the waist circumference, or the waist to hip ratio, which is actually a measure of the waist circumference too. You can see for the second patient is much more. All right, so 1.1. So BMI sometimes falsely, reduces the risk. Similarly, in the other picture too, we can see that the BMI is close. One has 30, the other 30.5. But the waist hip ratio, okay, is 1.2. So when you have isolated, abdominal obesity, because when you take the waist circumference in those two pictures, you'll notice that there seems to have isolated abdominal obesity. Those are risk factors. Okay, so what are we talking about? Now, we've been able to find out that people who have abdominal obesity, the risk of developing type 2 diabetes is high. So sometimes, occasionally, when we see clients and say, oh, this person has diabetes, the doctor will say, oh, we are not surprised. He has the face, or he has the features that, predisposes him or her to it. So the more the abdominal obesity, the more the risk of diabetes mellitus. So this is what we say in medical parlance now: diabetes, obesity, diabesity. Okay, so that's extremely important. Okay, so now for us, metabolic syndrome, what are the associations? So if you have metabolic syndrome, these are the potential problems that might arise. The first, like I said, is the cardiovascular disease. And here I've mentioned a few examples of this cardiovascular disease. We are talking about ischemic stroke. We are talking about peripheral vascular disease. We are talking about coronary artery disease, which can present as acute myocardial infarction, heart attack. And we know that is the leading cause of death in the developed world. Okay. Number 2, type 2 diabetes mellitus, and I'm going to share 1 or 2 slides, to address particularly the problem. So there is 3 to 5-fold increase in diabetes mellitus if we can demonstrate that you have diabetes, metabolic syndrome, non-alcoholic fatty liver disease. Okay, so the terminology should make you think that, oh, there is a fatty liver disease that is due to non-alcohol. Okay, so obesity, metabolic syndrome is a risk factor. When we see clients in the hospital and we see them, they have abnormal liver function tests, the first question we ask is, oh, are you taking alcohol? If they're taking alcohol, okay, we are not surprised. We say that is the cause. But we also saw liver disease in people who are not taking alcohol. And for them, the only risk factor we've consistently identified is obesity. That's metabolic syndrome. So we need to take care of that. And when we want to treat them, the only treatment is, oh, go and shed some weight. Hyperuricemia, okay, so they develop a lot of uric acid in the blood, and that can potentially cause gout. So they develop pains around the joints, okay, usually on the toe, and all that. PCOS, so PCOS means polycystic ovarian syndrome. By that, we mean that women who have diabetes or who have metabolic syndrome, there is a risk of having polycystic ovarian syndrome, and that is the chief cause of infertility. As a matter of fact, metabolic syndrome has been linked with infertility, that's one, or subfertility. So subfertility means, oh, the person has delivered before, but it's getting increasingly difficult to, conceive again. What about obstructive sleep apnea? Many patients come, I'm a cardiologist, many patients come to the hospital, they say, oh, we are sleeping, and then suddenly we woke up, trying to catch our breath, panting, for air, panting away. So most people think this is due to heart-related disease. But more often than not, when you ask questions and when you examine the patient, it's because they are quite obese. So when they are obese, they have a lot of fat around the neck, and that tends to obstruct the airway. Okay, so when they sleep, the tongue fall back, the soft tissue around the neck obstruct the airway, and then when the carbon dioxide in the blood rises, it stimulates the brain, and then the person wakes up trying to catch his breath. So that's it. Not only that, some cancers have been linked to metabolic syndrome. So examples include the cancer of the colon, cancer of the gallbladder, kidney, and possibly prostate cancer too. So studies have been done, and we found that people who have metabolic syndrome, who are obese, who have diabetes mellitus, they tend to have increased cancer rates that we've mentioned. Psoriasis is also, so when patient comes and they have this psoriasis, it's a type of skin lesions. And one of the tests we do is go and check your blood sugar, check your blood pressure, okay, so we see breast cancer too in women, recurrent preeclampsia. So by preeclampsia, we mean when women become pregnant, they develop elevated blood pressure that is life-threatening, both to the mother and to the kid. Neurocognitive performance. So people who have metabolic syndrome also have some cognitive issues. By that, we mean they tend to develop cognitive problems. Cognitive problems is they can't, the mental faculty is a little bit reduced. They develop when they get old, they age faster, okay? So they forget things easily, and it's also, it's also been associated with that. So this summarizes some of the things we've been saying, okay, in a pictorial form: cardiovascular, cerebrovascular disease, that's stroke, hypertension, breast cancer, colon cancer, prostate cancer, ligament and tendon injuries. So they develop back pain, joint pains because of the weight, okay, osteoarthritis, ischemic disease. And finally, what we call the venous thromboembolism. So they tend to develop blood clots inside the blood vessels, and occasionally these blood clots can embolize, to block a major vessel. So that is DVT, pulmonary embolism. So those are the potential problems that we can have. All right, so just to mention a few things about some of the elements of metabolic syndrome. Hypertension, very, very important. So we are saying that even though you don't have hypertension, if you continue to accumulate weight, okay, and you fail to control it, then you are inviting blood pressure. Some 1 billion people have blood pressure, in the world. Unfortunately, some 30% of them are not aware they have hypertension, okay? Now, among those who even know that they have hypertension, some 40% of them, they are not receiving treatment. Finally, some 67% of those who have blood pressures, their blood pressure is not controlled. So we need to be wary of these figures. So it is not about, oh, I have blood pressure. We also need to be sure our blood pressure is controlled by ensuring regular clinic follow-up. So the problem here is if you have a blood pressure that is not controlled, and the person that is not taking drugs or that does not even know that he has blood pressure, both of you have risk. So it is not surprising that when we get to the emergency, the number of people we see who have stroke, cardiovascular diseases, aerovascular disease, are people who have established hypertension, they're already on drugs. However, blood pressure is not safe control. So baseline, they are more or less the same as if they are not taking drugs. Okay, so just a few words on the epidemiology. Generally, metabolic syndrome increases with age. So as we age, we should be wary of it. Some 40% of people above 60 years, when you subject them to this criteria I've mentioned, 40% of them meet the criteria. Number two, metabolic syndrome and diabetes are increasingly prevalent. So when you have metabolic syndrome, then you are writing an invitation letter to a full-fledged diabetes. Note that in metabolic syndrome, I mean, most of, like at least the criteria before, most patients do not necessarily have established diabetes, but they have blood sugar that is elevated. Okay, so in a few years, if they fail to work on their weight, they may develop full-blown diabetes. Now, diabetes is a problem globally because we know that in the last 30 years, the figure has risen to about 382 million. Not only that, it is estimated that 1 in 10 people worldwide will have diabetes mellitus by 2035. And there's a corollary to that. The corollary is that it is also estimated that majority of these people by 2035 who have diabetes are going to be Blacks. In fact, we are worried here because we are going to be striking, so to say, by what we call the double problem. So we are the ones suffering from malaria, HIV, infections and all that. But we are also seeing increasing figures in non-communicable diseases that are particularly diabetes mellitus. So diabetes is a large global burden, everywhere. In 2017, just to show you this figure, you'll notice that across the world, these are the mortality, those are deaths in 2017 alone due to diabetes. If you look at the figure, in the Africa also has some 0.3 million, that's about 300,000 deaths are due to diabetes and its complication. Okay, and the figures are rising. What about Blacks? Now, generally, we found out that Blacks with insulin resistance, we tend to have higher HDL. Remember I said that the HDL is the good cholesterol, and we want it to be high, okay? So we found out that when we subject people to test, Blacks tend to have high HDL. Not only that, they also tend to have lower triglycerides. Now, like I told you earlier, we don't want the triglycerides to be high, okay? So when we compare them to the white counterparts, they tend to have lower risk factor. However, what we know is that the cardiovascular risk in Black is not lowered. So even at lower figures, that's why I say this is good news. At lower figures, at lower values, Black develop complications as bad as the Caucasians. So we don't even want our figures to be near what is recommended in the guidelines. Okay, so I need to emphasize that. So not only that, I mentioned that the components of metabolic syndrome, there are like 4 or 5. When Blacks develop hypertension, the hypertension is worse, it's more difficult to control. We tend to need a lot of drugs, maybe 3, 4, sometimes 5 drugs to control blood pressure in Blacks. Not only that, the complications is accelerated. So kidney problems, heart failure, stroke, those complications of blood pressure, of elevated blood pressure are accelerated in Blacks. So we need to be wary. All right, so what are the causes? Now, I've established that metabolic syndrome is bad. These are the components. What are the causes? I've mentioned some of the causes. Sometimes we are not exactly sure. So you can say that malaria is caused by Plasmodium falciparum. However, you cannot pinpoint a cause of metabolic syndrome, so we are not exactly sure. However, we know that there are risk factors. Number 1, family history. So if your parents are on the big side, they have hypertension, diabetes, they have poor lipid profile, then you have to be wary. Number 2, poor diets. This is the chief cause. So we know availability and consumption of high calorie, fiber diet, fast food. So some people, when they early in the morning en route to work, they branch at the fast food joint, they buy the fast food, that's their breakfast. En route home again, they branch, they take the fast food. Okay, I mean that constitutes their meal every day. So that's a very dangerous trend. In addition, inadequate exercise, and that comes as a decreased physical activity. So a sedentary lifestyle, mechanized transportation, people want to walk from one street to the other, they are in their cars, people don't trek, they don't walk again. I should even have this. COVID-19 has even changed the pattern. So a few patients have, in fact, a number of patients I've been seeing lately, and they tell you they've been working from home due to COVID-19, and they say, oh, I've gained a lot of weight. I used to be 70, now I'm 90 because I can't go out. I stay on the system throughout. So these are the problems. So this is the challenge of our time, and we need to work against it because, fine, we are working from home, COVID-19 can't make it out. But in the next few years, we are going to have problems on our hand, increase more hypertension, diabetes, stroke, and all that. So this is extremely important. What are the symptoms? There are no specific symptoms for metabolic syndrome per se. Occasionally, we see acanthosis nigricans, so that's not very common. So just like a black patch, okay, it can be on the face, on the armpits, at the neck. People go excessive ear, that's called hirsutism. Peripheral neuropathy refers to some abnormal tingling sensation on the hand, on the feet. More often than not, when you check the blood sugar of such people, it's usually on the eyesight. Retinopathy, if the person has developed diabetes, it can affect the eye, and so vision might be an issue. In fact, occasionally, the first time we know people have diabetes is when they have problems with their sight. Okay, xanthoma and xanthelasma, well, that is not common, especially in blacks. Okay, so they have, fat deposits, just like nodules. Okay, like, on the skin, on the neck, and all that. So, but again, I don't emphasize this when we're talking about metabolic syndrome. The symptoms, this is the symptoms when you see somebody like this, whether he has all those things I've mentioned, xanthelasma, then that person should be screened for metabolic syndrome. All right, so moving forward, how do we address this metabolic syndrome? How do we address it? Lifestyle changes and weight loss are considered the most important. So our lifestyle has to change. Okay, business tycoons, business executives that stay in the offices, okay, they sign all the papers, on the table. They take a lift, okay, up, they take a lift down, okay. Women particularly too, okay, sometimes, oh, I can't go out, they stay at home, sometimes they don't work all about. These are risk lifestyle that can enhance metabolic syndrome. As a matter of fact, what we know is that studies that have compared similar population of ethnicity exposed to different dietary environments have strongly suggested that westernized diet are strongly associated with high risk of developing metabolic syndrome. So somebody who was living, for example, let's say in Nigeria or Ghana, traveled to United Kingdom, America, he has gene does not change. So when I travel here to America, my gene is still the same thing. However, the lifestyle changes that I'm exposed to there, the diet, okay, the food I eat, the fact that I don't walk about, mechanized transportation, we found out that they tend to develop metabolic syndrome. So even though we mentioned family history, for the record, lifestyle plays the chief role in developing this disorder. So this is what we are saying. If you want to treat metabolic syndrome, this is the first thing. So you are going to throw away all this, okay? You are going to kick this from your meal, okay? That is very, very important. Hello, am I here?
Yes, you are, doctor. We can hear you clearly.
Hello?
Yes, we can hear you,
doctor.
All right, I need to be sure. Okay, sir. So you need to kick this out of your routine diet. So what should you eat then? All grains, beans, fruits, and vegetables that are high in dietary fiber. When you go to the fast food, a lot of this means they've been processed. Okay, so you take flour, you take meat pie, you take all those meals that are already processed. Okay, but meals that are high in dietary, so they've not been processed. Okay, vegetables, fruits, they are very, very important. Okay, not only that, we also know that this type of food, they tends to reduce insulin levels. Okay, because one of the problems, I didn't discuss that because that's not going to be important for us, that people who have metabolic syndrome, they have high insulin level, and it is the high insulin level that is driving the weight gain, that is driving the diabetes mellitus, that is driving the hypertension. So this means have been shown to reduce insulin levels in people. All right. So other recommendations, so like I said, calorie restriction. We can also, even so, we are not saying you can't take some of those meals, but you want to reduce the quantity too. So that is very, very important. And then you should attempt to lose weight. Okay, so target should be to lose about 5 to 10%, okay, in the first year. Moderate increases in physical activity. Okay, like I said, your dietary composition should reduce saturated fat and total intake. So fats, there's a lot of oils. As a matter of fact, oils in whatever form, when they are metabolized, they have a lot of high calorie, and they become stored in the liver, and then that promotes weight gain. Okay. In addition to, you may need to reduce salt, okay, because if the person already has established hypertension, okay, salt intake is shown to increase blood pressure, and then that becomes even a problem. So let's go to the way, let's be practical about this. Okay, skipping, very, very important. This picture, we see it very often. And even in African, people of African descent, we're beginning to see picture like this. Okay, so obesity in children from 15, okay, 10, 15. So if you have a child like this, you may not want to punish him. If he does anything, just say, oh, go and skip 50 in the morning, 50 at night for 3 days. I call it 50 BD for 1 week. Okay. So let's go to the practical demonstration. We talk about aerobic isotonic exercise. These are of greatest value for subjects who are obese. So isotonic exercises are exercises that you do that you tend to move your joints. Okay, you move your joints, you move your body, not necessarily a weight-bearing exercise. Okay, so I'll give you examples shortly. So cycling, jogging, and all that. You want to do this for about 30 to 60 minutes and about 5 to 7 times in a week. Okay. Anaerobic isometric exercise too, okay, including resistance training, can be cautiously added as an adjunct once aerobic goal is achieved. So isometric exercises, those are weight bearing, for example, maybe some weightlifting, but these are not even of priority because when you weightlift, you are just in a place, you are static, you are not really moving. But the major ones are the ones that enables you to move your joints, basically to move from one place to another. When you do this, the way to tell is that the exercise must induce some sweating. And if you can assess your heart rate, okay, if your heart rate can increases by half, oh, that's fine. So maybe before you started the exercise, your pulse rate was 80 beats per minute, and then you are now reaching 120. Oh, that is an indirect measure that we have done sufficient exercise. So you should sweat and your heart rate should increase. So these are some of the examples like I mentioned. You want to walk last few blocks home from work. So you are going out, you are coming home. You tell the driver, okay, you don't want to stop me here. Let me do the rest by trekking. Okay. You want to walk briskly around your house every day. You can ride bicycle. You can join TV exercise class because these are scheduled. Because they are scheduled, you tend to be regular with it, not the one you choose yourself that you can decide to cancel and say, oh, I'm tired today, I can't continue. But TV programs are more or less their schedules. You can go to the gym. If you have stairs in your house, you can walk up and down several times. These are practical exercises you can do. Like I said, you can measure how much you've done by targeting, some 50% increase in your heart rate. So only when this fail, okay, then do we do medications. Okay, so lifestyle changes is majorly important. Okay, however, if we are not getting results, doctors can do this. This is probably not important for everybody. So for those who have blood pressure, established blood pressure that is elevated, we give drugs, and these are the choice drugs that we give. Dyslipidemia means, like I said, the cholesterol is high. That is the LDL, or the HDL, which I mentioned was the good one, is low. Okay, you want to give statins. In some cases, even before somebody develops full-blown diabetes, we give metformin. So the individual is obese, is on the big side. Okay, we feel that this person is likely to develop diabetes in future. We start him on metformin. Metformin is a drug for diabetes. Now, because of the effect, metformin tends to help in weight loss as part of its mechanism of action. It also reduces appetite. Okay, so we want to avert full-blown diabetes. In some cases, we can give blood clotting drugs, especially in people who are very obese and they've had blood clots in their legs or elsewhere before. Blood clots anywhere, we can give, we may want to give aspirin. Okay, I've mentioned metformin. Other drugs are glitazones. Okay, sometimes for people with high cardiovascular risk, okay, we give glitazone, but again, these are to be given under the guidance of a cardiologist, because that can also potentially worsen people who have heart failure. So if somebody has heart failure, sometimes we don't want to give glitazone. These are drugs that are at the discretion of the physicians. Okay, so but like I said, these are last resort, when we are not achieving results. All right, so how do we prevent obesity? Okay, so there are, I'm gradually rounding up. Primordial. So primordial means even before somebody gives birth, okay, you want the mother to take healthy diet, okay, so that we don't want the baby to become very big. Unfortunately, in some part of the world, people think, oh, my baby is 4.3, my baby is 4.4. In medical parlance, these are not necessarily good, because people who have very big babies, such people tend to have diabetes mellitus in future. That is the mother himself and the child too. You are setting a good foundation for him to become big, in future. The primary is to improve your healthy lifestyle, like I've mentioned. So you want to take choice of food, okay, choice. I've enumerated before. Also, finally, health talk, public enlightenment, okay, cultural practices that tends to promote, sitting at home, not doing exercises, we want to avoid all this. So if we do this, we might be able to avert an impending catastrophe that, our conditions, predisposes us to. So these are my few talks my thoughts I want to share with us on metabolic syndrome. In summary, I've said it's not a disease, it's a constellation of symptoms, 5 of them, but the chief important one is that of, abdominal, isolated abdominal obesity. The others will include hypertension or blood pressure that is, going high, diabetes mellitus, or blood sugar that is greater than 100 or 110 milligram per DL. Okay, if your triglyceride is high, these are blood tests, or your HDL is low. I've said that it's a leading cause of mortality or morbidity worldwide. It is potentially preventable. It is a door to other problems, and those problems are not necessarily cardiovascular, like we mentioned. So cancers are involved, okay, neurocognitive problems are involved, skin diseases, psoriasis are involved, and a host of others, okay. Treatment is majorly lifestyle changes, and then drugs when we don't get results. So this is another slide showing what we are talking about. Even for physicians, if I want to examine these patients, I'm going to rely heavily on investigations, because the soft tissue in the body prevents me from hearing the heart rate very well. I can't examine the tummy very well if the person has a big liver, if the person has a big kidney. The soft tissue, tends to prevent me. So I tell you, oh, just go and do this test, and I need imaging modalities. All right. So, just 3 questions to test how far I've been able to pass the message. Yeah, which of the following are risk factor for developing metabolic syndrome? Increasing age, obesity, congenital heart disease, sedentary lifestyle. Which of them is one, except one? Dr. Abodun, which one?
Doctor, I think our audience should type the answer.
Yes.
You can type the answer in the box.
Okay,
I think that is IS would expect me to answer it. Let our audience benefit from the lecture.
Please type the answer.
Okay.
So we have questions for you from our doctor. Please type your answer. So let's see whether you are following.
Type your answer
in the chat box.
Which of them is a risk factor for metabolic syndrome? Increasing age, obesity, congenital heart disease, sedentary lifestyle.
Please type your answers in the Q&A chat box.
We have answers coming in already.
Great.
Somebody said congenital heart disease is the only exception among the options.
Okay.
Someone said obesity. I'm not going to give the final. Yeah, I'm not going to give the final answer. Somebody said A, B, and D. So I think you have used the medical our multiple choice question format that would say except everything, not if not. And this may confuse the audience, but of course, I'm sure some people will eventually still get it. But are you able to see the responses? It's in the Q&A, I think.
Okay.
And some is in the chat box.
So only one answer is applicable here.
Yeah, I can see one answer. Somewhere I can see anonymous attendee B, D. Okay, somebody said sedentary lifestyle. Somebody said obesity. Hey, who said?
Somebody said that's Bilal Adelopo C, and there is Azizat Sanusi said C as well.
C as well. Okay.
Sorry for calling out the name if you are not.
Okay, so
yeah, and there are other people too have chosen C.
Oh, that's other people. Okay, let's go to the second one.
No, are you going to give the answer for the first one before we move?
I will. Okay, so which of them can make you have metabolic syndrome. Increasing age, yes, we mentioned it. So that's true, that's correct. So as we age, the tendency to increase metabolic syndrome increases. Remember, we said from 40% of people above 60 years. So that's
Absolutely.
correct. Obesity, yes. Oh, we even mentioned that is absolutely correct. Congenital disease. Congenital disease refers to heart diseases from birth. So that's not correct, because nobody, if you have a congenital disease, you develop other problems. Okay, sedentary lifestyle. Oh, you sit down in one place, and I give an example of COVID, where you work from home. Okay, so the answer here is congenital disease, because the question says except. So all the other things are risk factors. Okay, except congenital. All right, that's not bad. What about this? Metabolic syndrome is associated with increased risk of all except. So if you have metabolic syndrome, what are you likely to develop either now or in future? Give me the answers. I'll check the question and answer tables. A, cardiovascular diseases. 2, type 2 diabetes mellitus. 3, hypothyroidism. 4, non-alcoholic fatty liver disease.
Interesting question. Keep the answers coming. Keep the answers coming.
Yes, I'm enjoying the way the answers.
I think C. You're not sure. More responses.
More responses coming, keep coming in.
I think C is dominating already.
C appears to be dominating, that's correct. Oh, C again. Hey, any other contrary answer? Everybody cannot say C. I want somebody to say other one. You don't score.
Okay, I would say
C
E
again.
then. I would say E. Of course, it's not part of the option.
Okay. All right. So that's impressive. Okay. The answer is actually C, because if you have all the metabolic syndrome, you can develop cardiovascular disease. We mentioned that, stroke, ischemic disease, peripheral artery disease, type 2 diabetes. Oh, that's, in fact, I showed a graph showing the linear relationship between abdominal obesity and type 2 diabetes. Hypothyroidism, no, even if it is, it's not established. I didn't mention that. So hypothyroidism means there's a gland in the neck that is called thyroid gland. If it is not functioning well, it's not producing enough hormones, you develop hypothyroidism. That is not established for metabolic syndrome. Non-alcoholic fatty liver disease, I mentioned that okay, people who take alcohol, they develop liver disease. But people who don't take alcohol too, they develop liver disease, and their own is called non-alcoholic fatty liver disease. And the chief culprit, the chief cause is metabolic syndrome. When you're on the big side, when you have hypertension, when you have diabetes, you check your liver, you see the person has increased echogenicity in the liver, so what we tell them to do is to shed weight, and then we give drugs. All right, thank you very much. And my third question, which is final, is okay, I need to. Can you still see my slide?
Yes, but still on the previous one.
The third question is not coming.
Yes, I don't know. Let me see.
Now the questions are afraid of our audience. Seems they are very, very much knowledgeable.
Wow. Is that a problem? Let me see.
Oh, maybe you can just recite it from your slides.
If we read
okay,
it,
can you see
we can type it.
We can see it now. We can see it now.
I think
great.
Can you see it now? Okay,
It's on now. It's on now.
Yeah. So most effective treatment of metabolic syndrome. Yeah, number 1, A, B, C, D. The questions.
The answers are coming in already. Coming in at the speed of light.
Okay, so B, I have one answer here. Another person says B, B, O, B. Okay, more. Okay, B as it.
Allahu Akbar.
Allahu Akbar, mashallah.
Okay, so lifestyle changes, that's correct. So lifestyle changes is very, very crucial. And you know, it has to be an active thing. That's what I keep telling people, that it has to be an active thing. So you can give excuses that, oh, I gotta work, I take a bus, it drops me in the front of my office, I sit down, I sign papers, I don't have time to go out, I take the same bus. You can give excuses to, but when I say active, you have to attempt to change the lifestyle yourself by deciding to, you know, do exercises, okay, that is fairly regular, okay, you know, choose what to eat, diet, regulation, especially when you know you have the risk factors. I've said this is the most important. It's more important than gene. It's more important than, oh, my family was big. My father was a big man. My mother is a big man. I have 5 children already, so I'm entitled to be very big. I have, you know, yeah, those are potential excuses, but you need to work against it, because really, eventually, I mean, when the disease comes, they don't listen to all these excuses. Okay, so the diabetes doesn't say, okay, this is your lifestyle, I have to key in. You have to key in. Okay, so those are the, I'm impressed by the responses we've gotten. It means the message has been passed, and we pray Allah subhanahu wa ta'ala make us able to, you know, work on all this. I'm going to pause here. If there are questions, may Allah subhanahu wa ta'ala accept this as of ibadah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam
wa rahmatullahi wa barakatuhu. Alhamdulillah. Alhamdulillah. So you want to take on, go ahead.
Yes, I was just saying that it was a very interesting session, and it seems it shouldn't stop. Alhamdulillah, we want to say Jazakallah khairan to Dr. Thakib again. He's a consultant cardiologist, and he's working with Oak Hospital in Ikorodu, Lagos, Nigeria. And he has taken us through the topic. I'm sure if you even joined at the end of the session, you would have gained one thing or the other from the quiz session. So I'm sure we have posted in the Q&A session, the Q&A box, that if you have questions, please do ask your question. I'm aware we have questions already. Alhaji Rashid, have you seen them?
Yes, I can only see one here.
Okay, I
except there is another one into the chat box.
Yeah, I think there's another one already. But before we go to the questions, I have a question as well. So maybe I should be raising my hand here rather than using the razor.
Okay.
Inshallah. Yes. So Dr. Thakib, thank you so much for the lecture. And you did mention one of the ways to encourage lifestyle changes should be to go on aerobic exercises. But there are these different advertisements online that people do watch that do encourage them against aerobic exercises, saying that aerobic exercise, especially for abdominal fat, that aerobic exercises won't do so much. What do you have to say to this type of advice?
Okay, so yeah, the problem is that people, so more often than not, the such advertisement, sometimes they want to advertise something, maybe sell something or market something. So it does help, okay? Definitely. I've also mentioned that it's a combination of lifestyle that, that helps. So I saw a client who I asked, okay, on the big side, what do you do? He says he does exercises, aerobic, isotonic. What look like some aerobic, isotonic exercises? Then I ask, what do you eat? That he doesn't eat much. Okay, can you enumerate exactly in exact terms what you eat? He doesn't take breakfast. I just take a big pie and cook in the morning. I go out, I buy biscuits in the afternoon. I tell you, by the time he enumerated, that's more than five cups of food. So really, aerobic exercise does help, but again, in combination with other lifestyle changes. Okay, so it does help, especially another problem I need to mention is that the earlier the better. So people who have extensive abdominal fat, okay, advanced, so the changes, I mean, you gain fat, you gain mass, you gain weight easily, but to shed takes some little while. So it does help in some little way in combination with other lifestyle changes. Definitely.
Jazakallah khair. So we'll go back to the question. We have 2 hands raised already, but we have questions in the Q&A. So Alaji, how do we go about it to take the raised hands?
Let's quickly take it in turns, and then maybe we take 2 questions in the Q&A, then we take one person raising up their hand to also ask their question, and we take it in turns like that. I think the first question, I'll go for the first question here. Our brother, Muslim, is asking, can we commence metformin as a precautionary measure for those at high risk of developing diabetes? So I'll take the 2 questions. You answer them in turns. Then when you finish, then we go to the next one. Anyone raising up their hands. So the first question again: can we commence metformin as a precautionary measure for those at high risk of developing diabetes? And the second question from Rashida Azan is: how would you advise someone with arthritis to manage exercising and keeping active because of pains? How would you advise someone with arthritis to manage exercising and keeping active because of pains? Go for it, doctor.
All right. The first question: can we commence metformin as a precautionary measure for those at risk of developing that? Yes, we can. So, but that has to be done by a clinician, by a physician, okay? Because again, you don't want the blood sugar to become too low. So if somebody has not developed full-blown diabetes, but is on the big side, he has what we already call impaired. Really, type 2 diabetes mellitus is a progressive disease. So at the stage when the blood sugar is normal, then it gets to a level that is, we call it impaired fasting glucose. Okay, so here the blood sugar is, above normal, but not yet to get to the range where we can pronounce the person as having diabetes. And then the third stage is full-blown diabetes. So if somebody is in that range of, we call it impaired fasting glucose, impaired glucose tolerance, you can commence metformin. As a matter of fact, metformin is the only drug that is approved for that, because as part of its mechanism of action, like I said, it promotes weight loss. I mean, that's the major reason why you are giving it at that stage. It promotes weight loss, and then that's one of the things we want to achieve. So in addition to other lifestyle changes. Okay, so how would you advise someone with arthritis to manage exercising and keeping active because of pains? Yes, really, it's a problem that we see every day, because again, one of the problems of metabolic syndrome, people who are obese, is that they develop back pain, they develop joint pains, and that becomes a problem because they can't do a lot of exercises. So such people can do little exercises, as tolerated while managing the condition, because really, it is not just exercises, even their normal lifestyle too, they develop pain. So while managing those ones, giving drugs to relieve pain, and other non-pharmacological ways, there are other non-drug method of shedding weight, or of treating arthritis. You have to use all that, so you tolerate now. But the problem here, or the advantage, is one of the non-pharmacological ways, that the non-drug way, is to shed some little weight. Okay, so it's so you want to shed some little weight. When you shed weight, we believe that the joint pains can reduce, because really what is causing the joint pain is that the knee, the ankle is bearing the weight of the body, and it tends to cause the bones to rub over each other, and then develop arthritis. So little exercises that are tolerated can be done. Cycling can be done. I mean, this often you can see when you cycle, you can see that doesn't involve so much movement of the joint, but you shed some sweat, the heart rate increases, and then so it's something we have to weigh, both front and back. All right. Thank you.
Jazakallah khairan, sir. I don't know if you permit me to add to that.
Okay, go ahead.
Especially for the question of the metformin.
Yes.
That rather taking it as precautionary or prophylactic. I don't know. I mean, in this particular environment, I assume that it will be a prescription drug, and it's usually better to see the general practice that the person is using, or the practitioner that's attending to the person, rather than in a situation where you would go to in your own. I mean, maybe in Nigeria, of course, we need to be careful about that as well. A person is supposed to see the specialist like Dr. Thakib, for instance, and seek advice, and not just go to the laboratory, run this test yourself, go with the results and feel, well, the next thing for me would be to use metformin. So it is a prescription drug. You can't just go on the counter and get it and start using it in the UK, but even in the Nigerian context as well, you need to see a doctor. And we can't overemphasize, I'm sure Dr. Saki will agree with me, that using drugs with doctor's prescription is the absolute safe way to use drugs. So this is just what I wanted to mention, sir.
Thank you very much for that emphasis. Please, like I said, it's only only a doctor can prescribe it. I mean, I've mentioned this just for academic purposes, that okay, we do this, we do that, but this has to be done by a trained physicians. Okay, thank you for that emphasis. Thank you, sir.
So yes, let's go to the question. People raising hands up. I think we have a couple of ones. So go for it, Dr. Amin, please.
Yes, so I'll appeal to Dr. Majid, because he's a doctor. I don't know if it is Dr. Majid, the Majid we have there, but because he's a doctor, I would go to the second person. So please, please, apologies for that. So we want to take from Sister Afsa Bello first. Are you there now, Ma? Are you able to ask your question?
Unmute yourself, Sister Afsa Bello.
Please unmute. Is she able to unmute? No, I think the technical crew would probably need to unmute her.
Sister Afsa Bello, can you please unmute Sister Afsa Bello so that you can ask her question? The technical crew, please.
Hello? So
She's still muted.
Why should we wait for her? If Dr. Majid is available then to ask his own questions, so that we don't keep people waiting. So either of the two questioners. Wa alaikum salam. Wa alaikum salam tullah.
Firstly, I want to say Jazakallah khairan to Dr. Thakib for that beautiful presentation. Well understood, and we really enjoyed it. I've learned a lot myself. So just a little addition on what Dr. Thakib clearly mentioned about prophylactic metformin for people at risk of metabolic syndrome. Within, obviously, that's probably in Nigeria. Within the UK, that's not an indication for starting metformin. However, if you see when he explained that some people are pre-diabetic, those who are not normal, but they're not diabetic, those people in that range, if there are risk factors, the doctors can, after specialist advice, can start metformin in rare cases. But like Dr. Aminullah mentioned as well, in all of these cases, I mean, if you're in the UK anyway, but Nigerian people here, they could get medications from Nigeria. So I would say before you start any sort of medication, I think everyone have actually highlighted that very well. You need to speak to your GP, speak to them about your risk, and inshallah, take things from there. Jazakumullah khair.
Inshallah.
Thank you very much, sir.
So, Sister Afsabile, are you ready now for your question? Maybe we can go back to the Q&A.
Okay, so we go back to the Q&A while we're waiting for her. The next question there says, is there a treatment for migraine? Is there a treatment for migraine? And the second question say, what about genetic fats? I think it's the same. It's an anonymous attendee. I don't know whether they are connected, but you just say, what about the genetic fats? Maybe the doctor will understand what this question is all about. The first one says, is there a treatment for migraine? And second one says, what about genetic fat? Doctor, maybe you can take one more, please. Can we take one more?
Yeah. So is there a treatment? Okay, I'm listening.
If lifestyle is changed, but the underlying factor remains, the family history for the CVD, how do we address this? Let's take CKD or diabetes as example. If lifestyle is changed, but the underlying factor remains the family history for the CVD, how do we address it? Let's take CKD or diabetes as example. Go for it, doctor.
Okay, so is there a treatment for migraine? Yes, indeed, there's a treatment for migraine. Just for the knowledge of those who may not know, migraine refers to a special, we call them primary headaches. So it is not the headache you have because you have fever, you have malaria, you have infections, but they are just, primary headaches. They are headache conditions in themselves. The commonest one is probably migraine. So it's usually a unilateral throbbing headache. Sometimes it's bilateral. Okay, so it's worsened by photophobia. So the person doesn't want to see light, doesn't want to hear sound, because these are things that worsens the headache. And then the same time they have nausea, they vomit, and it comes in paroxysms like that. It can last for 24, 48 hours and all that. So that's migraine. There is a treatment for migraine. I usually advise people to see the neurologist for this, and they might evaluate the problem and then give you appropriate treatment. Indeed, there are many headaches, and some of them actually can overlap. So a clinician will be able to delineate which drugs, which of the type of primary headache you have, and the appropriate treatment can be given. Just to mention, there are drugs that control the headache at that acute onset. So if you have severe headache, clinician gives you drugs that control the headache, and then there are drugs that prevents the risk of developing it, more like prophylaxis. Okay, so please, you may want to see your clinician, your neurologist in that respect. What about genetic fats? Okay, so like I said, people have some people have inherent predisposition to accumulate a lot of fat. So they are genes that. Hello. Walaikum.
Yeah, I've got a question here. So the question is, are Apple Watch or other smartwatches really work towards a healthy lifestyle?
I'm not sure I got you, although I'm answering one question first.
Yes, please allow our doctor to finish the question he's answering. You can keep your hands raised up. We'll call you, inshallah. Go ahead, doctor.
I was asked to unmute myself. That was why I unmuted myself. Yeah, sorry to interrupt. I was asked to unmute myself, and I unmuted myself just to ask my question. I thought it's my time to ask the question.
Okay.
All right, that's fine. Yeah.
Doctor, please go ahead.
Okay, so genetic fat, people have inherent predisposition to accumulate a lot of fat, because indeed there are some genes that predispose some people to fat. Leptin is one of it, okay, among others. So now, really, these are, I don't know the figures in the UK, but even in UK, I mean, from the figures, these are not very, very common. These are not very, very common. Most causes of fat or metabolic syndrome, they are acquired. So what do you do? What are the things you don't do? The things you do and the things you don't do are what predisposes you. All right. So now, even for those who have this genetic predisposition to develop fat, well, so if you know somebody like that, then it's a cause for concern to start, avoiding other lifestyle changes. I mentioned that when we are talking about causes, we have a predisposition, that's family history, genetic history, and then lifestyle changes. So lifestyle changes play the major role. So you want to reduce all those lifestyle changes. That's number one. Number two, it's also an indication to, so when those are not work, is that it becomes an indication to do other things. So medications, okay, so but these are outside the scope of this talk. So there are medications that are given, and there are some other things that are done, including some surgeries, okay, bariatric surgeries and all that, okay. So these have been shown to help, but across all disciplines, even after these non-lifestyle changes, even beyond them, when we finish, for example, bariatric surgery, we still say that, oh, the lifestyle changes must continue. So you must continue to encourage, exercise, change your diet. So they are always there all the time. All right. Thank you. If lifestyle is changed, but the underlying factor remains the family history of CVD, how do we address it? Let's take CKD or diabetes, for example. I think I've in a way addressed this too. Okay. So
yeah,
I've addressed it. So diabetes, so all these things work together. Okay, perhaps maybe the family history, maybe 20, 25, 30%, the others are lifestyle. So if you work on the lifestyle, you may want to delay the even onset of diabetes, okay, or even, it may not even occur at all. Thank you very much.
Doctor. I think we have just about 5 minutes to the end of this session. We have Olaide Adekoya hands up. Can you please unmute yourself and ask the question quickly? And if it is possible, we'll take one more question on the chat box, and then we can close the session, inshallah. Olaide Adekoya, please go ahead.
Okay, thank you very much. Yes, I've already put my question in the chat box, but let me ask it. The question is, Apple Watch or other smartwatches really what is towards a healthy lifestyle?
Okay.
You get my question?
Apple Watch, I can see it in the chat box. Apple Watch or other smartwatches really worth it towards a healthy lifestyle. So I need to understand the mechanisms. How do they work?
Exactly. This is what I wanted to say, that we need to be very careful. So what these watches are all about is that you have them measuring the number of steps you have taken in a day, for instance, and as a result, they will calculate the number of calories you could have burned in the process and things like. So it's more of technological gigs, so that they can encourage people to walk, like the number of steps you've taken, the number of kilometers you've covered, and things like that. So those are and it's linked to your devices. So the watch is smartwatch, which is linked to your phone. So and this is just a technological which is more used in the Western environment anyway. So I think that is, I don't know if I put the context there for you to be able to answer the question.
Okay, so it's available here too. I mean, in fact, a lot of people use it now. So they tell you, yes, now, I mean, they tell you, oh, I need to, this is where I am. I need to, targets are already set. So you want to quickly make the daily targets. So like Dr. Aminu said, they are okay, they help you to monitor what you have done or what more you need to do. They are technological advancements, and if you keep by them, they may just help you if you are very diligent and if you are diligent with it. So they are all goals. They are all aimed towards achieving the same thing. Really, I don't have a problem with that.
MashaAllah. I think the last question that we'll take, we have just 2 minutes more. What can women with PCOS do to lose weight? Note, the weight increase is due to this condition in the first place.
Exactly. So the polycystic ovarian syndrome. So women develop some cysts in the kidney, and kidney, and this promotes weight gain. Obstetrician and gynecologists usually address this in any case. So sometimes they give drugs. Occasionally they give drugs are given. Lifestyle is also there, and sometimes surgeries are done. But here medications are very very important. Okay, so you see your GP or you see your gynecologist, medications are given to reduce the risk in combination with, lifestyle changes is always there all the time, in addition to what the medications is doing. So you treat the PCOS and you continue your lifestyle.
Jazakumullah khairan. This would come to an end to this session. And I'm very, very sure that would have all gained one or two things. Personally, even myself, even being in the medical field, still I still had a lot. I gained a lot from this session. So over to you, Alhaji Rashid.
Jazakallah khairan. We thank Dr. Thaqib. We appreciate you. This is a very, in fact, it took his time to bring it down to layman, and I understood everything. For those of us who have isolated abdominal obesity, you don't need to be told by a doctor. We know ourselves. I think we know ourselves. When we wear shirts or when we wear our native, we know what it means when we see ourselves. So I think
and another cultural thing that we forgot to, maybe Dr. Shaki forgot to mention, is that they say if you have abdominal belly fat, you are the one to be giving the most money in the occasion.
Evidence of good living. I was going to say that.
Now,
yes, it's evidence of good living. So
initially, now you have to be very, very careful.
MashaAllah. So we need to do something about it, and it goes for us, the brothers, and it also goes for the women as well, that we should try as much as possible to have lifestyle changes. We can't emphasize that enough. Lifestyle changes, starting from our food, starting from our exercising on a daily basis and all that. May Allah subhanahu wa ta'ala make it easy for all of us to be able to adopt all these tips that have been given to us. May grant us sound health and keep us, all of us, safe and on the path of Islam for a long, long time to come. Allahumma ameen. So we thank you, Doctor. At this point, we would like to bring this session to a close until we meet again in a couple of minutes, where we will engage ourselves again in another beautiful program that will take us through for another couple of hours, inshallah. Also, I think we also have brothers program later today, inshallah. Let's keep a date with all these programs. Couples hangout will be in a short while after salat, after our salat, Dhuhr, inshallah. For those of us who are married, and for those of us who are also preparing to go into marital life, let's keep a date with couples hangout, inshallah. We have 3 couples in the house who will be taking us through that session. I think later in the afternoon we'll also have a lecture, Mercy from Above, which will be handled by our stars as it can. Let's keep a date with that as well, inshallah. Over to you, Abdul.
Alhamdulillah, Jazakallah khairan. From the Muslim Forum of Britain, we say Jazakumullah khairan to you, Dr. Thaqib, for granting us your time, and for our audience for joining in. We shall be closing this session for Salah break and a recess so that we join back by 2 for the couples seminar. Subhanakallahumma wa bihamdik. Ashhadu an la ilaha illa ant. Astaghfiruka wa atubu ilayk. Subhana rabbika rabbil izzati amma yasifun. والسلام على المرسلين والحمد لله رب العالمين. جزاكم الله خير. السلام عليكم.
وعليكم السلام ورحمة الله وبركاته. Thank you.
وعليكم السلام ورحمة الله.
Alhamdulillah.
Dr. Sak, if you can stop sharing your screen, if you don't mind. I think it's okay. I don't know if he's the one sharing or it's okay. It's our platform. Yeah, just want to be sure.
خلقي أسوتنا دستوري كتاب الله دستوري وخير الخلق أسوتنا
بسنته جلا نوري بهدي الحق أرشدنا
كتاب الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا كتاب الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا لزمت محاضن القرآن فذكر الله يسعدنا عرفنا إخوة الإيمان وللأخيار صحبتنا تميزنا بكل الفن وتجمعنا محبتنا وصدق القول نعرفه وخير الخلق يعرفنا تعالينا كتاب الله دستوري وخير الخلق أسوتنا
بسنته جلا نوري بهدي الحق أرشدنا
الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا كتاب الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا لزمت محاضن القرآن فذكر الله يسعدنا عرفنا إخوة الإيمان وللأخيار صحبتنا تميزنا بكل الفن وتجمعنا محبتنا وصدق القول نعرفه وخير الخلق يعرفنا تعالينا الله دستوري كتاب الله دستوري وخير الخلق أسوتنا
بسنته جلا نوري بهدي الحق أرشدنا
الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا كتاب الله دستوري وخير الخلق أسوتنا بسنته جلا نوري بهدي الحق أرشدنا لزمت محاضن القرآن فذكر الله يسعدنا عرفنا إخوة الإيمان وللأخيار صحبتنا تميزنا بكل الفن وتجمعنا محبتنا وصدق القول نعرفه وخير الخلق يعرفنا تعالى